Are you feeling unusually tired? Or perhaps noticing some subtle changes in your body? But maybe you're just brushing them off as, getting older. Well, what if these were actually early whispers from your kidneys, asking for help before serious problems start to kick in? You see, creatinine is a waste product that's filtered by your kidneys, and when its levels rise, it often signals that there might be some issues with kidney function, even before more obvious symptoms appear. Knowing these early warning signs can really help you address any underlying issues early on and hopefully prevent further complications. So, in this article, we're going to explore 6 early signs that your creatinine might be rising, explain what they mean, and give you some guidance on when it's a good idea to seek medical help. Number 1, fatigue. So, the first sign we're talking about is persistent, unexplained fatigue. This is actually one of the most common, yet frequently overlooked, early indicators that your creatinine levels might be on the rise, signaling a potential decline in your kidney function. Now, this isn't the kind of ordinary tiredness you feel after a long day or a rough night's sleep. Instead, it's a really profound sense of exhaustion that just doesn't seem to get much better with rest. Many people describe it as a heavy, dragging feeling that can make even simple daily tasks feel like a monumental effort. The connection between rising creatinine and this fatigue mainly comes from the kidneys' reduced ability to do their vital job. When your kidneys aren't filtering out waste products efficiently, toxins, including something called urea, can start to build up in your bloodstream. This condition is known as uremia. And this buildup can directly impact your energy levels, making you feel sluggish and even a bit mentally foggy. Your body is essentially working harder to cope with an internal environment that's becoming more and more imbalanced. Another really significant contributor to fatigue when we're talking about kidney dysfunction is anemia. You see, healthy kidneys produce a hormone called erythropoietin, or EPO for short, which tells your bone marrow to make red blood cells. These cells are absolutely crucial for carrying oxygen all throughout your body. So, when kidney function declines, EPO production often goes down too. This leads to fewer red blood cells, and as a result, a reduced oxygen supply to your muscles and brain. And this lack of oxygen, well, it shows up as weakness and that pervasive tiredness. Furthermore, ongoing kidney issues can lead to inflammation throughout your body. This systemic inflammation itself can be a major drain on your energy reserves, really adding to that feeling of constant weariness. The fatigue that comes with rising creatinine can be quite debilitating, affecting your mood, your concentration, and your overall quality of life. So, it's really important to pay attention if you experience a new or worsening pattern of fatigue that you just can't pin on other causes. Recognizing this early on can be a crucial step towards checking up on your kidney health. While fatigue can be a general symptom, another more visible sign might start to appear, especially in your lower body. Let's explore what that is. Number 2, swelling edema in legs, ankles, and feet. All right, moving on to our second sign. When your kidneys aren't working at their best, one of the more noticeable signs can be swelling, which is medically termed edema, particularly in your lower extremities. Think your legs, ankles, and feet. This happens because kidneys that are compromised struggle to remove excess fluid and sodium from your body effectively. And as a result, this extra fluid can start to accumulate in your tissues. Now, the force of gravity naturally pulls this excess fluid downwards. That's why swelling often first becomes noticeable in the ankles and feet, especially after you've been standing or sitting for a while. You might notice that your shoes feel a bit tighter than usual, or perhaps your socks leave indentations on your skin that take some time to disappear. This is what's known as pitting edema. When you press a finger into the swollen area, it leaves a temporary little pit or dent. While the legs, ankles, and feet are common spots, edema related to kidney issues can sometimes affect other parts of the body too. Some people might experience puffiness around their eyes, particularly in the morning, or they might notice some swelling in their hands. This generalized fluid retention can also lead to a sudden, unexplained weight gain, as your body is essentially holding onto extra water. The swelling might be quite subtle at first, maybe just a slight puffiness that you could easily dismiss. However, as kidney function continues to decline and more fluid is retained, the edema can become much more pronounced and uncomfortable. It can make movement difficult and cause the skin over the swollen areas to feel tight and stretched. So, paying close attention to any new or worsening swelling is really important, as it directly reflects your kidney struggle to maintain proper fluid balance. Beyond physical swelling, changes in what leaves your body can also be a significant clue. What your urine tells you is up next. Number 3, changes in urine output or appearance. Okay, let's talk about your urine. Your kidneys play such a central role in producing urine, so any significant changes in your urinary habits or the appearance of your urine can be direct indicators of underlying kidney trouble and potentially rising creatinine levels. These changes can show up in several ways, and it's important to be observant. One possible change is a noticeable decrease in the amount of urine you produce. If your kidneys aren't filtering blood as effectively as they should, they might produce less urine. On the other hand, and this might seem surprising, some people with early kidney damage may actually experience an increase in urination, especially at night. This condition, known as nocturia, can happen because the kidney's ability to concentrate urine is impaired. This leads to the production of larger volumes of dilute urine and consequently more frequent trips to the bathroom. The appearance of your urine can also offer some vital clues. For instance, foamy or bubbly urine that needs multiple flushes to clear can be a sign of protein in the urine, a condition called proteinuria. You see, healthy kidneys filter out waste and water, but they hold on to essential proteins in the blood. When the kidney's filters, called glomeruli, are damaged, protein can leak into the urine. The more bubbles you see, especially if they stick around, the more likely it is that there's a significant amount of protein. Furthermore, the color of your urine is important to watch. Urine that is consistently darker than usual, say, tea-colored, brown, or even pink or red, might indicate the presence of blood, a condition known as hematuria. This can be a sign of various kidney problems, including infections, kidney stones, or more serious glomerular diseases. And while very pale, almost clear urine, if it's coupled with excessive thirst and frequent urination, might also warrant attention, as it could reflect the kidney's diminished ability to concentrate waste. Really, any persistent deviation from your normal urine color, frequency, or appearance should prompt a discussion with your healthcare provider. What goes in, or rather, what you don't feel like putting in, can also signal trouble. Let's look at how your appetite might change. Number 4, nausea and loss of appetite. Next up, let's consider nausea and loss of appetite. Feeling persistently nauseous or experiencing a noticeable loss of appetite can be quite distressing symptoms, and they might also be subtle indicators that your kidneys aren't functioning as they should, leading to a rise in creatinine levels. When your kidneys are compromised, waste products that they would normally filter out of your blood begin to accumulate. This buildup of toxins, particularly urea, is known as uremia. Now, uremia can have a significant impact on your digestive system. These accumulated waste products can irritate the lining of your stomach, often leading to feelings of nausea, especially in the morning or after meals. In some cases, this nausea can be severe enough to cause vomiting. Your body is essentially reacting to the internal imbalance caused by these retained toxins. Another common complaint that comes with declining kidney function is a change in your sense of taste, or a persistent metallic taste in your mouth, which is medically referred to as dysgeusia. This unpleasant taste can make food seem quite unappetizing, further contributing to a loss of appetite. You might find that foods you once enjoyed no longer appeal to you, or you might find that everything just tastes bland or somehow off. Consequently, this ongoing nausea and lack of interest in food can lead to reduced food intake and, over time, unintentional weight loss. You might find yourself feeling full quickly, even after eating very little. While many conditions can cause nausea and appetite changes, if these symptoms are persistent, unexplained, and perhaps accompanied by some of the other signs we've talked about in this article, it's certainly wise to consider the possibility of underlying kidney issues and consult a healthcare professional. If your body is struggling to get rid of waste, it might also struggle for air. The next sign takes us to your breathing. Number 5, shortness of breath. All right, let's talk about shortness of breath. Experiencing shortness of breath, or dyspnea as it's known medically, particularly if it's new or seems to be worsening, can be an alarming symptom. And it may indeed be linked to rising creatinine levels and declining kidney function. There are a few key ways in which kidney problems can lead to difficulty breathing. One primary cause is fluid overload. When your kidneys are unable to effectively remove excess fluid from your body, this fluid can accumulate in various places, including your lungs. This condition, known as pulmonary edema, or fluid in the lungs, makes it difficult for your lungs to expand properly and exchange oxygen efficiently. You might find yourself feeling breathless during physical activity, or even when you're just resting or lying down. Some people find they need to prop themselves up with extra pillows at night just to breathe more comfortably. Anemia, which as we discussed earlier, is a common complication of kidney disease due to reduced erythropoietin production, also contributes significantly to shortness of breath. With fewer red blood cells to transport oxygen, your body's tissues and organs, including your heart and lungs, don't receive an adequate oxygen supply. This can leave you feeling winded, even with minimal exertion, as your body struggles to meet its oxygen demands. Furthermore, kidneys that are severely impaired can struggle to remove acid from the body. This can lead to a condition called metabolic acidosis, which is an imbalance in the body's acid-base levels. Your body might try to compensate for this acidosis by increasing the rate and depth of your breathing in an attempt to expel more carbon dioxide, which is an acid. This can manifest as a feeling of breathlessness. So, if you're experiencing unexplained shortness of breath, it's crucial to seek medical attention promptly to determine the cause. From internal struggles for breath, we turn to an outward sign that might be irritating your very skin. Number 6, itchy or dry skin. Our 6th sign involves your skin. Persistent itchy skin, known medically as pruritus, along with unusually dry skin. These can be another subtle, yet troublesome indication that your creatinine levels may be elevated due to underlying kidney issues. While skin problems are common and can have many causes, when they're related to kidney function, they often have specific characteristics. One of the main reasons for itchy skin and kidney disease is the buildup of waste products, such as urea and other toxins, in the blood when the kidneys aren't filtering efficiently. These substances can actually be deposited in the skin, triggering irritation and that persistent urge to scratch. This condition is sometimes referred to as uremic pruritus. The itching can be widespread or localized, and it's often described as being deep under the skin. Sometimes it becomes more intense at night, potentially disrupting your sleep. An imbalance in certain minerals within the body, particularly phosphorus and calcium, can also contribute to itchy skin. When kidney function declines, levels of phosphorus can rise in the blood because the kidneys are less able to excrete it. This elevated phosphorus can then indirectly lead to skin itching. Additionally, kidney disease can affect the health and function of sweat and oil glands in your skin, leading to chronic dryness. Your skin may become rough, scaly, or cracked, which can then exacerbate the itching. Standard moisturizers might offer very little relief if the underlying cause is actually related to kidney dysfunction. So, if you develop persistent, bothersome itching or unusually dry skin that doesn't respond to typical remedies, especially if it's accompanied by other potential signs of kidney trouble that we've discussed, it's definitely worth discussing with your doctor. Now that we've explored these 6 key indicators, you might be wondering what exactly causes creatinine levels to rise in the first place. What causes high creatinine? So, what's behind high creatinine levels? Well, high creatinine levels in the blood primarily indicate that the kidneys are not filtering waste as efficiently as they should. Several conditions and factors can lead to this. For instance, chronic kidney disease is a major cause. This often results from long-term conditions like diabetes and high blood pressure, which can gradually damage the kidney's filtering units over many years. Acute kidney injury, where kidney function deteriorates rapidly, can also cause creatinine to spike. This might be due to severe dehydration, a significant loss of blood, overwhelming infections like sepsis, or even the effects of certain medications that are toxic to the kidneys. Some examples include certain non-steroidal anti-inflammatory drugs, or NSAIDs, or specific antibiotics when they're used improperly or in people who are susceptible. Reduced blood flow to the kidneys, perhaps from heart failure or a narrowing of the arteries that supply the kidneys, can also impair their function and elevate creatinine. Additionally, conditions that cause extensive muscle breakdown, such as rhabdomyolysis from extreme exercise or injury, can temporarily increase creatinine levels because, as we mentioned, creatinine is a byproduct of muscle metabolism. And finally, obstructions in the urinary tract, like kidney stones or an enlarged prostate, can also back up urine and pressure, damaging the kidneys and raising creatinine. What to do if you notice these signs? Now, if you recognize one or more of the early signs we've discussed, such as that persistent fatigue, swelling, changes in urination, nausea, shortness of breath, or itchy skin, it's really important not to ignore them or try to diagnose yourself. The first and most crucial step is to schedule an appointment with your healthcare professional. Your doctor can perform a comprehensive evaluation, which will likely include a simple blood test to measure your creatinine levels and calculate your estimated glomerular filtration rate, or eGFR. The eGFR is a key indicator of how well your kidneys are filtering waste. Urine tests may also be ordered to check for protein, blood, or other abnormalities. You see, early detection and diagnosis are absolutely vital. Many forms of kidney disease can be managed much more effectively if they're caught in the early stages. This can potentially slow down their progression and prevent more serious complications down the line. Your doctor will work to identify the underlying cause of any kidney issues and then recommend an appropriate management plan. This might involve lifestyle changes, medication, or perhaps a referral to a specialist. So please, don't delay seeking medical advice if you have any concerns. So, to wrap things up, recognizing these early signs of rising creatinine like fatigue, swelling, urinary changes, nausea, shortness of breath, and itchy skin can be absolutely pivotal in protecting your kidney health. These symptoms are essentially your body's way of signaling potential issues. Promptly consulting a healthcare professional for assessment and appropriate management can lead to timely intervention and really help prevent serious long-term complications. Did you find this information helpful? If so, please consider sharing this article with your friends and family to help spread awareness. You can also subscribe for more health tips. And please, feel free to comment below with your experiences or any questions you might have. Your engagement truly helps us raise awareness about kidney health and the importance of early intervention.